Since its market launch in March 1996, Gunze Pelnac has been widely used as a dermis regenerating material for cases of full-thickness skin loss. Gunze is a pioneer in the area of grafts for dermis loss and is at the forefront of the field. Pelnac is an artificial dermis material developed to regenerate lost dermis. Its clinical characteristics include excellent secondary graft take and preserving cosmetic appearance. Because there is no need for dermis transplant, extremely thin skin grafts are possible, minimizing damage to the area from which the transplanted skin is collected. Pelnac consists of an inner sponge layer of atelocollagen derived from porcine tendon tissue and an outer layer of silicone film. At 1 week after implantation of Pelnac, infiltration of the atelocollagen sponge layer by fibroblasts and blood capillaries from the wound surface or surrounding tissue can be observed. During the 2nd and 3rd weeks, granulation tissue that is filled with fibroblasts and blood capillaries and that corresponds to transplanted skin is formed, indicating dermal regeneration. At that time, only the outer silicone film is removed, and it is possible to perform a thin skin graft of 8 to 15,000th of an inch. The name Pelnac is derived from the first syllables of pellicle and natural, and the C of collagen, to mean a pellicle of natural collagen. Pelnac's major characteristics are its pore size of 70 to 110 microns, enabling easy infiltration by fibroblasts and capillaries, and extremely soft and thin sponge-like structure, so it adheres well and easily adapts to the wound surface. A mesh-reinforced type is also available, providing 4.5 times the suture strength of the standard type. Moreover, the wound surface can be easily observed, enabling post-implantation progress to be accurately confirmed. Remove Pelnac from the package and soak it thoroughly in sterile physiological saline. Pelnac is supplied in a sterile condition, so it must be used immediately. Insufficient hemostasis will impair Pelnac's adhesion to the wound surface. Clean the wound and disinfect it thoroughly so no hematoma remains. If there are any septic wounds in or near the implantation area, thoroughly disinfect at the time of surgery. Cut the Pelnac sheet to match the wound. Confirm that the collagen sponge side is facing the wound surface. In some cases, it may be necessary to cut drain holes to prevent retention of exudate. Place the collagen sponge side against the wound surface. Use a suture or surgical stapler to secure the Pelnac sheet to the surrounding skin. When using 2 or more Pelnac sheets, secure them to each other in the same way. After attaching, place gauze on top and use a tie-over dressing or similar to secure with light compression. At movable areas such as joints, attach securely in the same way as a conventional skin graft. When a light red color is presented and dermis-like tissue has formed, the silicone film will naturally peel away. Even if some white-colored areas remain, skin grafting is now possible. After cleaning the area, perform a split-thickness skin graft. This is a case of 3rd-degree burns. Use of Pelnac enabled an extremely thin mesh skin graft to be performed to regenerate the lost dermis with good post-operative results. This is a 1-year-old girl who suffered 3rd-degree burns to her lower thigh. 10 years after the skin graft, the results can be called good. Gunsei is contributing to the future of healthcare and medicine by developing and producing new medical materials, and is dedicated to earning the trust and confidence of patients around the globe.